70,000 Montanans fall into the Medicaid category. 70,000 in this state. And there's really no excuse for not meeting those folks' needs. And just so you know, because I didn't, the folks we're talking about are folks that make $12,000 or less. They get no help, none.
You are talking about millions and millions of dollars into the Montana economy. You are talking about tens of thousands of good paying jobs being created in the medical field.
And Medicaid expansion and having those additional dollars flowing into these Indian health clinics is going to improve the quality of life for people.
I talk to so many people who say, that's crazy. Are you saying that I'm too poor to get help and somebody who makes $3,000 more than me can get access to affordable care? And the answer is yes, and it is crazy. In Montana, we are a small state. If you go to your neighbor and you ask for help, your neighbor's gonna give you help. We believe, we fundamentally understand that when our communities are safe and healthy, we're all better off. I think that people are shocked. People don't understand what not passing Medicaid expansion means in Montana.
I don't see a negative in providing an avenue to health insurance and health care for residents of Montana or residents of the U.S. in general.
I think if people actually sat down with somebody who falls in the Medicaid coverage gap, who's working their butt off to take care of their family, and they're eligible for nothing, that would change minds. Medicaid saves people's lives.
We have some of the worst health disparities, whether we're talking about infant mortality rates, whether we're talking about diabetes, heart disease, number of other health issues that are really hitting Indian people pretty hard. It means that the care that they could be receiving earlier on in their life that would potentially prevent some of these diseases isn't occurring.
Everybody likes to say, well, we have universal coverage, just go to an emergency room. You know, that doesn't work when you have cancer. Maybe it works if you have a broken leg, but that is not a solution. And so Medicaid is good insurance. We need people in communities to hear stories, understand the impact, and they need to be calling their legislators, and then we need to be talking to the legislators. It needs to be a groundswell of understanding and support for our neighbors in our communities to have access to affordable health care. And that's what Medicaid is.
I think that there needs to be some more education on why it's important for Indian country, and to have tribal councils step forward and talk to the legislators that represent the areas where their reservations are. The impact of Medicaid expansion in Indian country is going to be far-reaching.
Because organizing works, and when you talk to your neighbor about issues that impact their lives, they listen and they care and they get engaged in it.